welcome. Thank you for
Thank
your
you.
time today. My name's Keymn. I'm a member of the National Co-Production Advisory Group. I'm an expert by experience in Solihull, and I'm a carer, and I've been a carer for my mum for 16 years. Could you please tell me your name and your role?
Yes, I'm the Director for Communities and Adult Social Care in Solihull, and my name's Ian James.
Okay, and how long have you been in Solihull?
Since 2012, so just over 3 years.
Okay, brilliant. So, what have you done in terms of co-production in Solihull?
One of the things I realised when I first came to Solihull was that we didn't work particularly well with people who used our services and carers. We were very traditional in what we did, so it was very much we as the professionals decided what was best for people, and we thought we engaged with people very well because we had various engagement groups and we used to produce drafts of things, and then we'd take them out and we'd consult on them, and people would say what they thought, and then we'd take them away, and then we'd decide finally. And it was a very traditional approach in that way. And so what I wanted to do when I first came here was signal a new approach to the relationship between the council and the people who use our services. And interestingly, preparing for this interview, I actually went back and looked at the presentation that I did, because we had a big launch event in Solihull in April of 2014, which is quite interesting to go back and look at some of the things that I'd said there. And I said quite clearly, it signalled a new relationship between the council and the people who used our services. And in fact, the first slide was a big slide that said, "Why didn't you ask us?" Mm-hmm. Because a lot of the time, that's what people were telling me. Why don't you come and ask us? Why don't you work with us? So it was a very simple message in a way. Although there were a number of other things that I said as well, and I was. I got some of those here actually because it was interesting. So, and one of the things I acknowledged at the time was that actually, while it signalled a new message, it was part of that was actually going to be very uncomfortable for us as a council, because we quite like controlling things. That's what councils and public and professional services do. So, as well as saying it's a different relationship, we were saying we were going to give up some control as well. And I also remember saying at the time that we didn't know where it was going to go. We didn't know what was going to happen with this new thing that we were creating. But it was a genuine offer to the audience that were there, and there were probably about 50 users and carers, I think, at that event, to say, I want you to tell me and to tell us how you want to get involved in the services that we provide.
And could you give me any examples of any co-production that you've taken part in?
Yeah. Well, what happened from then was people actually told us there were 4 priorities that they got, or four big messages they wanted. And the first one of those was that actually, there's a simple one which is about listening to us. So, and listen to us in terms of actually take notice of what we say, rather than just listen and then go away and do what you want to do anyway. So that was very important. The second one was about involve us in, and it was the words were the big stuff as well. So don't just bring us draft leaflets and say, what do you think of that? People wanted to get involved in all the things that we were doing, because we've had a big transformation programme, as you know, here in Solihull, and people said we want to get involved in all of that. The third one was we want to be valued as equals, and that's something that I took very seriously. So I've been very clear that co-production means that we have some expertise as professionals and people who are involved in public services. Lots of people who do use services are huge experts in the services that we provide, much more so than we are, and actually bringing those two sets of expertise together is the basis for co-production.
So what is the fourth one?
The fourth one was users we can help, which actually people wanted to get involved in things. And I do remember at the beginning there was a little bit of frustration because it takes a while to set these kinds of initiatives up. And I remember for some people they really wanted to get involved in things, and that took a while to get going. And so some of those activities took a while to get started. So they were the 4 key messages at the beginning. And I think we've done a good job between us in a co-production way of actually involving people in those or answering those priorities that people gave us right at the start.
Ian, you mentioned about involvement. How did you involve people in the community, carers and people that use services?
Well, as I said, we had a launch event, so we sent out an invitation, and I can't remember the exact numbers, probably between 50 and 100 people came to that. And that was a way initially of getting people signed up. And actually that was really significant. And I remember getting a letter from somebody after that, from a carer who said something like, I've been a carer for 26 years and the council's always tried to do a good job, but I've never felt that we were involved in the way that we could have been. And she said, this feels like a breath of change. So through the launch event, I think we did create some sense of change. And that meant that when we then wrote out again, because we said we were setting up a Making It Real steering group, we wanted to create a group of experts by experience and also explore other ways of involving people. We got, it was almost like word of mouth, meant that people were enthused and then people got involved in through that process. So we recruited our group of experts by experience, and we set up an experts by experience steering group to decide how we should continue this process, because right from the beginning it's been co-production. And I started off saying, I don't know where this thing's going to go. And actually it's right, I don't know where it's going to go, because we want to co-produce it.
Fantastic. Can you reflect on what you've learned in regards to co-production?
The thing that's been most powerful for me, and it follows a bit from that not knowing where the thing was going to go, was that, and this is actually quite painful for me actually, this is actually, I've learned a lot through this whole process, because I think, I mean, we all of us tend to pigeonhole people, don't we, into, we see people as in, different groups. And although, as a director of social services, I thought I don't do that. So although I use the phrase service user and carer, I think that actually I view people as individuals, and we deliver personalised services, and people are human beings, and I don't pigeonhole them. I think what I realised looking back was actually I did, and I probably still do to some extent, think service user and I think carer. Because the most significant thing that's happened to me is that out of this whole process, not only we've developed a good approach to co-producing services, but actually people have got lives from what we've done. So they're actually people who probably would have defined themselves as service users, to be honest, or defined themselves perhaps primarily as carer, have then been able to go on and get jobs from what they've done, or they've gone to be part of the co-production advisory group. We've got people who've gone and set up community interest companies, and people who are going out and delivering dementia training. And we often talk about the need to think about people as assets and what they themselves can do and what they can contribute. And what I didn't foresee right at the beginning was actually that was the real thing that we were going to deliver through co-production. So from my perspective, it's been brilliant as a director of social services, because people have brought so much into the way that we've developed and improved services over the last 2 years. And I sort of got that that's what should happen. The bit I envisaged was actually all these people who got involved would then go off and do loads of other things and become part of what I now see as a creative Solihull community who are actually out there doing loads of different things to help support improvement of services. So that's the bit that I've learned most. I've actually learned a bit about myself, actually. But I've also learned that sometimes you do have to go with your feelings a bit. We're very fond of controlling things in local government, and sometimes you know what the right thing is to do, and you just have to go with it, even though you're not quite sure where it's going to end up. And I don't, this thing will evolve further again. So that for me is probably the biggest bit of learning, I think, that people have actually been able to redefine themselves probably as well through actually getting involved in this whole process, and that's been absolutely brilliant.
And what difference has it made working in that way to the people that you work with and the organisation you work for and the partners also that you work with?
Well, that's been important, because when I first started this, I remember people who work for me in adult social care coming and saying to me, why are we doing this? Yeah, we already work with people. We've got partnership engagement groups, and so there was a view that we were actually doing something we didn't need to do, and people were a bit frustrated. It was almost as though they were being asked to do something else. Work was already hard enough, and now you're saying we've got to do this co-production, or we're already developing our transformation programme, and now you're saying we've got to do it. So that was a starting point. Actually, it didn't take very long for people to get it, as it were, in terms of actually realising the value. That if you're if you're starting to think about how you want to deliver services differently, then actually having people who use services around the table right at the beginning is a really sensible way to start that whole discussion. It was very frightening for politicians as well. I remember my cabinet member getting, and I'm sure he would acknowledge this as well, getting very nervous when he met some of our experts by experience, because actually people were quite challenging. It's interesting, the motivation that brought people into wanting to be experts was their experience of services, and sometimes their experience of services wasn't particularly good. Now, what people really wanted to do is get involved because they wanted to make services better. But that can make some people very challenging when you first have the discussion about, well, what is it you're bringing and what is your motivation? And so for politicians in local authorities, that can be quite threatening, because politicians can be quite then defensive about, actually, we think we do a good job. But again, we've got our whole cabinet now, all of the politicians in the council recognise the value of what we do, and indeed would say this is not just an adult social care, this needs to be an approach that we use across the council as a whole. So that shift, I think, for staff, for politicians, and then the other group where we've been able to influence is on the NHS side. Because the NHS generally, I would say, is still in that rather traditional mindset of their various groups that they consult with, various engagement mechanisms, and that's not co-production. That is old style consultation and engagement. And through some of the joint work we've done with the NHS, a number of, the consultation, the review, the redesign of urgent care services at the hospital, hugely controversial topic. Were you involved in that?
No.
Okay. But most health systems, hospitals that have tried to review and change their urgent care systems have come up against huge opposition. And it's because what the NHS does is decide what the doctors think is best and the managers at the NHS, and then they go out and tell people, and people get a bit uppity about it, and the local politicians get involved. But actually the work we did reviewing the urgent care services here in Solihull was actually done as a co-production piece of work. So there was a patient group which sat alongside the professionals, and the patient group were represented on the overall board, and when the proposals came out, they were co-produced proposals, and they were co-authored by the patient group and by the professionals group. So I think we've had some influence on the NHS, but I would say to the NHS there's quite a lot more that we can do to strengthen and improve co-production in health services.
Great. Can you give me an example of how it has avoided making costly mistakes by getting it right or better first time through co-production?
I'm not sure I could give an example where I could say we've saved there's an immediate cost saving. I think the advantage of involving people right at the beginning is that what we do avoid is then designing services that we think are right, then having to talk to people, then probably starting to deliver those services, then realising that those services aren't working well, and continually going round a loop of trying to improve services but not quite getting it to where we need it to be. So some of the examples of the things that we've done, so the peer-to-peer reviews for people getting direct payments. So that's putting people either getting direct payments or maybe people who are thinking of using direct payments in touch with peers who are already getting direct payments, so that they can be supported and advised, and they can work with somebody as part of the process. Typically before for people already getting direct payments, before they have their review, they can sit down with a peer and they can almost have a discussion before they actually get to the formal process. Involving experts by experience in reviewing, talking to people who use home care services about their day-to-day experience of services, so we can use that to feed into our discussions and with people who provide services. I think the way we have developed our local account here, and it started off, the very first local account we did was very much the council wrote to the local account. It was an account of how well we thought we were doing. And then the second time around we started to embrace co-production, so there was an involvement of people using services in that production of the second local account. And then the one that we are just about to embark on now, I'm very much saying what I'd really like that to be is the people who use services holding us to account. So we've actually gone all the way from us effectively holding ourselves to account to doing it jointly to something which is more the people who use our services giving their account of how well they think we're doing.
Ian, do you have any top tips for co-production?
I mean, probably three things I would say. The first thing is you've got to be prepared to lose some control. It's no good as a director of social services or somebody working in social services thinking you're going to control this. You've got to be prepared to give that up and effectively place trust in people who use services. And as I said a little earlier, some people are going to come because they're angry about things, and that is actually quite difficult. But you have to be able to give something up in order to make it true co-production. The second thing is don't think that you can then control where it's going to go, because in that same spirit you have to allow the thing to evolve, and if you are really giving up power, then actually people will take that power and they will and they will take it where they think they need to. And the third one, I think, is that actually recognising that co-production isn't easy. I remember some difficult discussions we had to have with our experts by experience, because you start off in a spirit of enthusiasm, and then I remember some experts coming to me and saying, well, what we want to do is, and it's something to do with direct payments, and I had to say, well, actually there are some things we can't do, either because they're illegal or actually I will just bust the budget and I won't. So co-production is difficult in as much as you get the different bits of expertise together and then you have to work together in terms of how you best solve that problem. And it's difficult, it becomes difficult on both sides. It's difficult for professionals to give up some power. Sometimes it's difficult for people to use services to understand some of the constraints that there are on local governments. I think the third one would be accept that some of it will be difficult, but stick with it.
What advice would you give to other directors on co-production?
I suspect if you talk to any director, then they would probably say that actually they do embrace co-production and they've got some version of co-production going on within their council. I think my advice, and to some extent my challenge to directors, would actually be to question themselves about whether they are truly delivering on a co-production ethos on the beginning of equals, and where people who use services are part and parcel of everything that goes on in terms of service delivery and service development and design, because and that's partly a reflection on myself, where I think I got co-production and I started something, but it's become something which has actually been much more challenging to me. So my advice to directors would be to challenge yourselves on whether that co-production ethos in terms of partners, equal partners, is actually really the way that you are delivering your co-production principles. And beyond that, I would say actually this is what we have to do. We have fewer and fewer resources to do what we need. Therefore, our ability to create the resources by using the people who are experts in what we do, then that has to be part of the solution to the difficulties that we face in the future.
And is there anything else you'd like to add or like to say about co-production?
I've been here for 3 years and I've done loads of things and we've done some really good stuff here in Solihull. But if you ask me what's the thing that I'm proudest of that we've done here, it would be what we've done to promote the involvement of our experts by experience and to embed that whole ethos of co-production, not just in adult social care, but it's something that's accepted now across the council and also with our partners as well. And part of that pride actually is being immensely proud of those people who've worked with us who've actually then gone on to do other things as a result of actually being involved in the process. So it's been hugely beneficial to us as a council. But what I'm proudest of is actually the way that it's then supported the flourishing of a whole lot of other people as well.
Great. I'd like to congratulate you on what you've done with co-production. I think it's fantastic. And I think a lot of people are going to be out in the community now and have services that are easily accessible to them now because of that co-production that you've done. I'd like to thank you for your time and wish you all the best with co-production going forward in Solihull. Thanks, Ian.
Thank you, it's a pleasure.